faculty left double angle bracket faculty of food technology right double angle bracket department left double angle bracket technology of food products right double angle bracket discipline left double angle brackets sanitation and hygiene in livestock facilities right double angle bracket lecture 15 left double angle bracket disinfection in veterinary practice right double angle bracket Есенқұлова Ж Ж Cand. Of Agricultural Science, ASOC. Prof. Lecture plan 1. Classification. More about suborders squirrels. 2. Types of disinfection. 3. Disinfection quality control. Disinfection occupies an important place among veterinary sanitary measures, aimed at preventing and combating infectious diseases of farm animals. The doctrine of disinfection is the science of methods and means of destroying pathogenic microorganisms, which develops the theory and practice of disinfection of various objects, the mechanism of action of disinfectants on the microbial cell, as well as the destruction of living carriers and distributors, insects and rodents, of pathogens of many infectious diseases. When carrying out disinfection, inherent disinfection methods are used to destroy pathogenic pathogens that cause animal diseases. Pathogenic microorganisms, bacteria, fungi, viruses and spore-forming forms of microbes have the property not only to parasitize in the animal's body, but to survive in it for a long time when released into the external environment. It is known that infection can develop in the presence of closed links in the epizootic chain, consisting of a source of infection, an organism susceptible to the disease, and the necessary factors for the transmission of these pathogens from one individual to another. Careful disinfection, along with other measures, allows you to break the epizootic chain and destroy the pathogen. Types of disinfection depending on the purpose of the measures carried out. Preventive and forced disinfection are distinguished. Preventive disinfection is carried out in order to destroy or disinfect conditionally pathogenic microbes or pathogenic pathogens secreted by microbearing animals. Organizes it, in combination with the preliminary repair of premises and equipment. Before disinfection, a thorough mechanical cleaning of all surfaces subject to disinfection is carried out in the room. Thorough mechanical cleaning of surfaces is understood to be such a degree of cleaning that it is not possible to detect large particles of manure, feed and other contaminants. The most polluted surfaces, rubber mats, a slotted floor, the lower part of the walls, enclosing structures of machines, are irrigated with a hot 2% solution of sodium hydroxide or 3 to 5% hot, 70 degrees centigrade, solution of soda ash. After 30 to 40 minutes, the final mechanical cleaning and washing of the premises with a beating jet of water is carried out. After cleaning and washing the premises, floors, equipment are dried, including exhaust ventilation for this, as well as the accumulation of water on certain areas of the floor, feeders, etc. For livestock complexes, this disinfection is the leading one, therefore it is carried out regularly and thoroughly. Forced disinfection includes current and final disinfection. Current disinfection is carried out from the moment of the onset of the disease until its elimination in due time. The final disinfection is organized after the elimination of the infectious disease and the removal of quarantine. In case of diseases caused by spore-forming microbes, in the rooms where the sick animals were, after mechanical cleaning and disinfection, the wooden floor is removed and the top layer of earth, or the top layer of the adobe floor, is removed under it, after which it is disinfected with bleach. The internal equipment of the room is treated with a 2% hot soda ash solution, or 0.5%-1% sodium hydroxide solution, and repeated disinfection of the entire room is carried out. The manure of animals sick and suspected of having particularly dangerous diseases, after preliminary moistening with a disinfectant solution, is burned. The slurry is disinfected by mixing it in a slurry collector with dry bleach containing at least 25% active chlorine. With less dangerous white fish, the disinfection of manure is carried out by the biothermic method. In recent years, along with wet aerosol disinfection has become widely used. Obtaining aerosols and disinfection carried out by them is less time-consuming than the preparation and use of solutions. The bactericidal effect is achieved with less expenditure of chemicals. In addition, when injected into a closed room, aerosols penetrate into all hard-to-reach places and disinfect not only the surfaces of walls, floors, ceilings, but also the air of the room. For aerosol disinfection, formaldehyde-containing and chlorine-containing preparations are successfully used. Sterilization and disinfection. Sterilization is the destruction of all microorganisms, bacteria, viruses, spores, on an item. It usually refers to objects, e.g., instruments, drapes, catheters, needles, that come in contact with tissue or enter the vascular system. Disinfection is the destruction of most pathogenic microorganisms on inanimate, non-living objects, whereas antisepsis is the destruction of most pathogenic microorganisms on animate, living objects. Neither procedure claims to kill or inactivate all microorganisms, even when used properly. Antiseptics are used to kill microorganisms during patient skin preparation and surgical scrubbing. However, the skin is not sterilized. Cleaning is generally restricted in meaning to the physical removal of surface contaminants, usually with detergents or soap and water, ultrasound, or other methods. Although cleaning does remove soils and bacteria, it does not kill or inactivate viruses or bacteria. Disinfection usually involves the use of liquid compounds, such as phenol or its derivatives, alcohols, halides, aldehydes, quaternary ammonium compounds, chloroform, ethylene oxide, ETO, heavy metal ions, or dyes. Selection of the appropriate disinfectant depends on the desired result. Some disinfectants are effective at destroying a limited number of microorganisms, others are effective at killing all organisms, including spores. Common disinfectants, their uses, and necessary precautions are listed in table. In case of erysipelas of pigs, a 20% formaldehyde solution is used for disinfection, dispersing it at the rate of 15 ml per 1 m3 of room volume. Disinfection of the room occurs after 3 hours. You can also use a mixture consisting of 3 parts of formalin and 1 part of xylaneth or creolin, when using it at the rate of 10 ml of the mixture per 1 m3 of room. The exposure of disinfection is 6 hours. In case of paratophosis of calves and piglets, disinfection is carried out with a 40–35% formaldehyde solution, at the rate of 15 ml per 1 m3 of room, at an exposure of 6 hours. In case of bird pasteurellosis, the premises are disinfected by dispersing a 20% formaldehyde solution in them, at the rate of 20 ml per 1 m3 of the room, at an exposure of 3 hours. In case of tuberculosis of birds, a formalin creoline or acid naphtha mixture consisting of 3 parts of formalin and 1 part of xylaneth or creolin is used. The mixture is consumed at the rate of 15 ml per 1 m3 of room. The exposition is 3 hours. In case of foot and mouth disease, disinfection of premises with aerosols is carried out with a 20% formaldehyde solution, spending it at the rate of 20 ml per 1 m3 of the room, at an exposure of 3 hours, or with a mixture consisting of 3 parts of formalin and 1 part of creolin or xylaneth, spending it at the rate of 15 ml per 1 m3 of the room. The exposition is 3 hours. Aerosols of disinfectants obtained by an apparatus-free method are of particular interest. To obtain an aerosol, formalin and bleach can be used. A half dose of formalin is poured into the vessel, covered with bleach, mixed, and the remaining amount of formalin is gradually added. As a result of a violent reaction, an aerosol is released. To obtain an aerosol, 40 grams of bleach containing at least 25% active chlorine and 40 milliliters of formalin, 38 to 40% formaldehyde, are required per 1 m3. For disinfection of premises in the presence of animals and birds, agents with high disinfection activity are used, but harmless to them are 3% hydrogen peroxide, sodium hypochlorite with a content of 1.5 to 2% chlorine, and 1–1.4% alkali, etc., lactic acid for birds. Chemical disinfectants, means and modes of disinfection. A significant number of chemicals have been proposed for disinfection. But at the same time, it should be pointed out that their effectiveness largely depends on the conditions under which the disinfectant affects microbes. In order to increase the strength of the action of disinfectants, it is necessary to create such conditions during disinfection, in which the disinfecting properties of the drug used will be manifested to the greatest extent. Condition 1. The chemical disinfectant solution should act directly on the microbes. If the microbes are under a layer of dirt, manure, feed residues and other contaminants, then disinfection does not occur. All these contaminants will bind the disinfectant, detain it on the surface, and prevent mu from coming into contact with the microorganism. The microbe located inside or under the contaminants remains alive, even if all the contaminants are soaked with the disinfectant solution. This is due to the fact that the disinfectant dissolved in water will be almost completely retained on the surface, and the impurities will be soaked and moistened with almost pure water that has leaked out. Flash sterilizer emergency or flash sterilization is performed when an unwrapped, non-sterile item must be sterilized quickly. A gravity displacement sterilizer is used for this purpose. The item is placed unwrapped in a perforated metal tray and is sterilized according to the manufacturer's time and temperature recommendations. With detachable handles, sterilized items are transported to the or in the metal tray. It is difficult to deliver flash sterilized devices aseptically. The tray is hot, wet, and unwrapped, which means it collects dust, debris, and microorganisms more readily than dry, cool trays with biobarrier protection. This type of sterilization should be used only in emergencies when no alternative is available. The minimum time and temperature standard for a gravity flash sterilizer is 3 minutes at 270 degrees Fahrenheit to 275 degrees Fahrenheit, 132 degrees centigrade to 135 degrees centigrade, for metal or non-porous items, i.e., items without a lumen, and 10 minutes at the same temperature for metal items with lumens, porous items, e.g., rubber, plastic, and autoclavable sterilized power tools. Flash sterilization generally is not recommended for implantable medical devices or power equipment, unless specifically approved by the manufacturer. If an implant must be flashed, a rapid red biological spore test is used and can be read in 1 hour for a flash cycle. In flash sterilization, it is important to minimize the risk of contamination during transportation. The sterilizer should be located in the restricted area of the surgical suite or treatment site. It is advised to use rigid sterilization container systems left parenthesis. In view of this, it is necessary to completely clean all rooms and other objects subject to disinfection from manure, feed residues and other contaminants before disinfection. The second condition. Solutions of disinfectants most strongly manifest their effect in a heated form. Therefore, they should be used heated to 65 to 70 degrees centigrade. Formalin is heated to 30 degrees centigrade. Only solutions of bleach are used in cold form. The third condition. Disinfectants will only have a detrimental effect on microbes when they are used in the amount prescribed for each remedy, with the necessary strength, concentration of the solution. Disinfectants at work need to be saved, but spending them in an understated amount will not benefit, and will only lead to a waste of money. and working time. Condition 4. To achieve the death or neutralization of microbes, it is necessary that they be under the action of a disinfectant for a certain time. Therefore, the use of premises and other objects after disinfection is allowed only after a certain period exposure, depending on the strength of the disinfectant. In addition to the above conditions, you need to know that the disinfectant does not work equally on all pathogens of infectious diseases. Therefore, in each individual case, when choosing a disinfectant, it is necessary to take into account the characteristics of the causative agent of a contagious disease, and its stability in the external environment. Disinfection quality control. The issue of disinfection quality is extremely important. Many authors have found that under the influence of even effective disinfectants, some microbes often remain vital, grow on nutrient media, and even become virulent. How to determine the quality of disinfection? 2 to 3 hours after disinfection, samples are taken from floors, machines, feeders from 10 to 12 different sites. Within 1 to 2 minutes, wipe with a sterile cotton swab, then place it in a test tube with sterile water, 20 milliliters, and in this form send it to the laboratory, no later than 2 hours. The test tubes are prepared in the laboratory. Disinfection is recognized: satisfactory if there is no growth of microbes in the samples under study. At the current not less than 90% of samples. At the final stage, there is no growth in the samples. These indicators are used to assess the quality of disinfection. Preventive veterinary and sanitary measures in livestock farms before setting up for winter stable maintenance. Disinfection and deratization of 13 livestock premises, with a total area of 5868 sq.m, were carried out in 6 large peasant farms of the district, under the supervision of veterinary specialists. This preventive work is the most important link in the system of planned veterinary and sanitary measures that ensure the welfare of animals for infectious, invasive diseases, as well as the sanitary quality of products and raw materials of animal origin. According to the current rules, preventive disinfection, destruction of pathogens of infectious diseases, disinfection, destruction of pathogens of parasitic diseases, and deratization, destruction of rodents, disease vectors, are carried out annually in animal farms that are safe for diseases. Processing of livestock premises and paddocks is allowed only by special means that have manufacturers' certificates certifying their compliance with the requirements of state, industry, standards or technical specifications. When working with such tools, the conditions of the use and the safety requirements specified in the current instructions must be strictly observed. Owners of farms of all forms of ownership are recommended to carry out the following veterinary and sanitary measures for the prevention of animal diseases. At least twice a year disinfection and disinfection of livestock premises and farm territories. At least 4 times a year deratization, disinspection, destruction of blood-sucking insects, should be carried out regularly throughout the warm season. Bibliography Management and Welfare of Farmer Animals. U4 Animal Welfare Series. Wiley-Blackwell Methods to Analyze Agricultural Commodity Price Volatility, the Production Technology of Functional Food Products from Raw Materials of Plant and Animal Origin. Thank you for your attention. Consultations. Almaty, Reinbeck Ave. 348 Fifths, Building 2,208.